Hello, everyone, and welcome to another wonderful episode of your favorite talk show on Serenity TV. My name is Gunesh Shiso, and today we'll be discussing a topic that hits home to millions of Nigerians all over the country. And joining me today to discuss this topic would be
My name is Ikechukwu Obaba.
My name is Gloria.
Ifeanyi Chukwu.
okay. The title of the topic for today is Medical Bills Before Medical Care, a Nigerian Healthcare Challenge. Now, the question is, well, the topic is very low right now. It's something that everyone in the country questions themselves on a daily. Why should the medical hospitals charge before they'll treat someone especially in emergency cases? Is it ethical? Is it legal? Is it something that the government should accept or look aside and just accept it like go on?
Okay, thank you very much, my anchor, for bringing up this topic. Actually, this is a tropical issue because it borders on every living Nigerian. And not, we're not just talking about Nigeria, it even extends to some other African countries where we are still developing and trying to get a system that works. And now, when you talk about the health system, health is wealth, just like the famous quote always say. You understand? And you're talking about hospitals asking for bill before they admit or before they admit medication to patients. Yes, it actually happens, but it's not in all hospitals anyways. Because there are situations where, okay, I used to be the manager of Akachukwu Hospital and Maternity, and then because of a higher role as I would be assuming officer as the leader of Rotaract, I just stopped working with them.
Yeah.
You understand? So I know that situations of emergency, once they get into the hospital, we attend to it immediately. But this is a private hospital, well managed.
Okay.
So the case is different when you bring it down to government managed hospitals.
Okay.
Just like the experience we had last month, a friend of mine, his sister, was in labor. They kept her for almost 24 hours.
Wow.
Before they attended to her. And now, this is not just a question of deposit, that there was no fuel in a federal medical center. I don't want to call names, but this is a real time story that happened. Not until the girl had to call somebody, and the person now, who is a big wing, now had to call the director of the federal medical center before something was done. Out of the blues, by midnight, the Jane came on, and that was how the lady was attended to. And before all these things were done, the baby was already dead. And these are carelessness that result from ill management of some of these health facilities, and it shouldn't actually be the case. Now, yes, of course, the government is not meant to provide everything for the citizen, but they should create an enabling environment that life can thrive. And what is that enabling environment? They should create a system where that government managed hospital should be well equipped with the government money, and this money coming from the citizens' taxes and all of this things.
Yeah.
So
I would like to cut you short there. You say the government, right?
Yes.
Now, before we come into the areas, the government's role, we know that the government has their role to play in the health sector, right?
Yeah.
Now, before we come to that area, what about the hospitals? You understand? Forgetting about the government-owned hospitals, right? We all know them. What about the private ones? Is it legal? You think is something that they should do?
Yes.
I have a case. I think that's trended on the net.
Okay.
The woman, her husband couldn't gather up to the amount, and therefore the woman to perform the C-section. And running around for the whole thing, she lost her life. And the man came to the internet. Even months later, came to the internet and to talk about it. And that is actually one of the reasons why we had to talk about this today.
The truth is, like I said, this is actually a tropical issue because it borders on everybody. And if I'm not a victim today, I might be a victim tomorrow, or somebody closer to me might be a victim. Okay. So it's totally out of it because life is sacred and is a chief value. You understand?
Yes.
So it is out of place to say before you administer medication on somebody that the person must provide money. Yes, that is what the way the medical system is. It is, of course, you're supposed to make a deposit. But situation where somebody just came in on emergency or something like that that needs immediate attention, it is really, I feel, it's against the oath they take to preserve life and to save life at all cost. To now say, not until you deposit money, we will not attend to you. Because in the course of you waiting for money to be deposited, you could be losing lives. Just like the mortality rate we're having. On a daily basis, we have a loss of 172,000 mortality women dying out of pregnancy. And some of these things are preventable risks that we could actually avoid. But because these things are not put in place, there is no well-structured enforcement agency in the health system to check for these things and ensure that the practitioners are actually doing what they're supposed to do. You understand?
Yes.
There are people,
Yes.
there are situations where I had to, maybe as the manager, I had to say, okay, please administer to this person. Yes, of course. And at the end of the day, they stay in the hospital until they pay their bill. You understand? Sometimes we actually reach out to non-governmental organizations who are interested in saving lives, and then they could come to the hospital and bail some persons by offsetting their bill. And these are the things we should be looking at. So, capital no, it is an absurdity to say because you've not made a deposit, we will not attend to you, and then to the point of losing lives. No, it's unacceptable.
Okay, for some hospitals, they believe that once the person, okay, we accept to treat you, especially in emergency cases where accidents happen on the road and then these persons are rushed into the hospital and they decide that no, we won't touch this person until they make a deposit because they've had some past experiences concerning that this person, after they must have taken care of this person, the person up and left, ran away. So I think that's one of the things that make them, shy away from performing their duties.
Yeah, it's a two-way thing. Like I told you, I've managed a hospital as the manager, and there are situations where the nurses, my subordinates, had to pay over 500,000 naira,
Wow.
a bill that a patient incurred because they were careless and they didn't know when the patient disappeared from the hospital. These are some of the reasons why sometimes the management of hospitals have to take stringent decision on to regulate excesses of individuals, because there are those who actually don't even know how to be appreciative of the good you do to them. You understand? So, but what I'm saying is there should actually be checks and balances. You understand?
Yeah, yeah.
One, it is totally wrong to lose life just because you're waiting for deposit. And then, secondly, yes, if you are the minister on cases of emergency and stuff like that, once the person starts getting better, of course, you need to ask, because you're not actually rendering, it's not a charitable home. You understand? The medication and all of those things, the equipment, you are procuring them with money. You understand? So for you to stay in business, for you to keep saving lives, of course you need those money to keep providing the necessary ingredients or the necessary equipment or drugs you need to keep saving other lives. Because if you spend your savings on administering to somebody and then the person does not pay or he runs away with the money and then another emergency comes in, how do you do that? Before you know it, you stay out of business. So, in as much as they are saving lives, yes, it's still business they are into. So, they need to also keep being in business. But then, saving life as a chief value, as a sacred value, is non-negotiable. Thank you.
Okay, sir. Do you have anything to answer?
Yes, yes. When you said something about the government and the private hospital, you cannot just remove the government from the business of the private hospital, because one thing you should know that before, the private hospital cannot operate in vacuum. So the government is responsible for initiating laws that should regulate the actions of both public and private hospitals. Now, the issue we have when you come to this medical payment before medical care is that we have laws or acts that are not being implemented in the country. Now, if you look at in 2014, there was a National Health Act. I can tell you that nobody knows about that.
Yes, true.
Many Nigerians are not aware.
Yes.
If you go to section 20 of that act, that section provides that if a hospital or a medical practitioner fails to attend to you in an emergency situation, the person will pay 100,000 or go to jail for 6 months or even both, depending on what the court says. So these are things that Nigerians are very ignorant of. So the chunk of the issue is, first of all, we'll start from the government. So, but now, if you look at the budget, the yearly budget being presented, you see that the health sector gets less than 15% of the money that should be that is meant for the budget, which is not so. So there are many institutions, the health, the education. These are sectors that should get more focus, but because of the type of government we operate in Nigeria, you see that they are neglected, they are just sidelined. So if healthcare is getting less than 15% of the budget, then there is a problem. Just like you talked about the public hospital or the federal medical center where a person was neglected. This is almost a routine. If almost every Nigerian must have witnessed it in public hospital. I can say I've witnessed it when I went to also a public hospital.
Yeah.
We had to beg the doctor, like, please, can we move to your private hospital to get better healthcare? Why? Because of the delay. They process the tests and there are so many delays. So, but these are people, they work in public hospitals, they have their private hospitals. So now when they move you over there, they give you the attention you deserve. And now when you talk about payments before medical care, one thing about the private hospitals, many of them work with policies. So these are the policies that guide them. And because of the government can't regulate or can't implement the laws they have put in place to regulate these hospitals, both private and public hospitals, they form policies that are suitable to them and they work on it. So that is why when you see people complaining about going to this hospital and not getting, it's because of the hospital, they are trying to maintain their policy, and nobody goes in for it, nobody checks. Even if you look at the doctors and nurses that work in a hospital, these are professionals and they belong to professional bodies. These professional bodies also have ethics that guides them, guidelines. If you fail on these ethics, on these guidelines, these professional bodies can come after you. They can withdraw your license to operate. So the problem here is the checks and balances are not there. Nobody is doing it. So that is why this issue is predominant in our country today.
Okay, okay. I think I will agree with the fact that a lot of public healthcare, the issue that they're having is the fact that they are underfunded.
Okay.
They lack funds.
Okay.
Do you understand, from the government? Because coming to, like you said, almost every Nigerians have experienced one episode of going to the hospital and not being well attended to, or the other when you go to government sectors. The thing now is that it is in every human right to actually receive medical care, whether with money or without money. But if you are looking from the practical point of view, they need money to run their facilities. Do you understand?
Yeah.
Now, if we are coming, because in most cases, these things happen in government facilities. If we are coming to the fact that you have to bring money, when you go to the government hospital, I've had cases, I've had like a lot of, I've seen the one I witnessed. A woman went to the government hospital to actually give birth, but the issue there was no bed available.
Wow.
There was no place, there was no room for her. Like the hospital was overcrowded. Why is it like that? It's not supposed to be so. And this woman ended up giving up the ghost because they couldn't attend to her. They couldn't even deliver her baby on the reception hall there. So if you look at it, I feel that the government should actually pay more attention to the public sectors, because at the end of the day, most of these public sectors, they now depend on patients' money to run their facilities, and it's not supposed to be like that. If someone comes into the hospital, the first priority is to make sure that that person is okay. We've heard the fact that okay, sometimes patients run away when they can't afford them after they are well taken care of. But at the same time, that is where ethics comes to play. You know that it is in your own duty to make sure you save lives.
life should be the first priority before the money. Whether government or private sector, I think the first priority for them should be saving lives.
Yes, which is an
Saving
good
lives.
result. Yeah.
Do you understand?
Yeah.
When there is an emergency case, they should attend to the victims, because if you're waiting for, not everybody. Okay, there was something we talked about some time ago where someone mentioned that you could imagine now there's an accident and you
Yes.
take a victim.
Yes.
Like you might just be a passerby who take the victim to the hospital. Now they want you to undergo those registration and everything when you are not even the family. So if they don't administer immediate care to such person, the person is going to die definitely. So I think the government should actually focus their attention on these public sectors, and private sector should do more better when it comes to attending. They should do more better, because I believe that medical care is every human's right. We all have the right to medical care, whether with money or without money. Thank you.
Okay. Now, the National Health Act states that emergency cases must be treated without initial payment. Now, looking at this law that has been in place, do you think it's enforced in Nigeria today, or is it just for social purposes? Because, like you mentioned, sir, this act, not many people know about it. So I don't think it's enforced. Even if it's enforced, I don't think much people know about it. So, what do you think? And do you think that the government is actually helping in cases of emergency? Like she mentioned earlier, someone was, if you are going on the road and accidents take place, you think twice before going to help that person. So, looking at it, do you think the government is actually making cases, helping people with emergency cases in the hospital? And looking at the NHA Act too.
Okay. First of all, when you talk about enforcement, you first of all look at, is this act being made aware? Like, do people know about it? Because for a law to be enforced, people have to know that yes, this is my right. I will do this. If I'm denied access to medical care, I need to go to court, seek redress, and this and that. So if people are not even aware that there is a law that protect their rights or tell them what to do at a particular point in time in regards to medical care, then they are handicapped at that point. So they don't. So when you talk about even government enforcement, it is government will enforce it if people are aware of what is involved. So if I am denied my right to medical care, I go to the courts and then I seek redress. But in our society, the issue we have now is you have an issue, a medical, you've been denied medical care. Now you want to go to court. That is another issue, because one, you have to afford a lawyer, the process. And if you look at the type of country we have, the court processes are
Exactly, I
very
was going to come
stringent,
to that.
because you go to court and your case stays for months and weeks, even years. Even years.
Okay, sorry. The fact that you're talking about, if the citizens are aware, creating awareness for that particular NHIS, right?
NHA. Yeah.
Now, if the government, even if an awareness is being created and people get to know,
Yes.
that, okay, I have the right to. Talking about the country we are living in, this is Nigeria. If you go to a government hospital, I'm sorry, but I feel that most of this healthcare, they are money minded. Even if you have to go there and they ask you to bring 1 naira or 2 naira and you say you don't have money, that is my right to so and so. This part, so and so part of the law states that I have the right to this thing. And some of them will tell you that, okay, go, let the law treat you. Then what do you do? Even at the end of the day, at the process, when it's an emergency, when you go, that same law will still be the one dragging you back. Like you said, you have to be able to afford the lawyer. And if you don't have money for medical treatment, how do you afford the lawyer? How do you now process this case to court? Do you understand? So we are talking about them implementing this thing. It's not even about the awareness should be there. Creating the awareness should be there. But I think the government should now make it, if they are enforcing such law, they should make it a compulsory, like make it a must. That if you go and tell these legal practitioners or these healthcare centers that, okay, this is the penalty you get if this thing is not attended to. Do you understand? They should make it something well known. Because if you are saying we should know our rights, there's a lot of things we know. Okay, you have a right. A policeman cannot actually see you on the road and stop you. But these days you don't have the right. Even when you talk, they'll slap you on top. because the law sector, they are not working. Our law in this country is not working. So if we are talking about governments enforcing or getting citizens to do their rights, a lot of us do. We know our rights. That when we get to the hospital, if it's an emergency case, you must be attended to. Now, what about these people practicing this occupation, like this our healthcare providers? What are they doing? The question should go to them. What exactly are they doing? Knowing your rights alone is not even enough. Because even after you know your rights, you must still have someone there for that right to be attended to. So I think that is it. That government should just enforce. They should pay more or emphasize more on enforcing the law in and out of both public and private sectors.
Yes.
That's what I believe. I think they should enforce the law. Aside from creating awareness for everyone to know that you have the right to this, they should actually enforce those laws. After creating that, they should enforce the law. So when you go to hospital, you can get an adequate service. When you get to the hospital, if there's something urgent and you need an urgent treatment, you should be attended to.
Okay. It's
Sorry, I want to add something.
okay.
The thing is, in Nigeria, we refuse to accept the reality we have on ground. We shouldn't be talking about theoretical statements that has no place in the practical sphere. You understand? We are talking, the NHA said this, said that. Well, that is not obtainable. You could walk into just the name, Federal Medical Center, and somebody will be asking you for a tip before they will attend to you. That, okay, you bring 5,000, let's go and buy fuel. Like, how sensible? You can see that this country is already, like, something is wrong somewhere. You understand? So we shouldn't really be talking about these theoretical things or you going to law court and stuff like that. The most practical solution is, if you need medical attention, please, even though it is more capital intensive to go to private hospitals, but that will save you a lot of stress and even losing your beloved one. Then secondly, we have to be practical, like I said. Please, first of all, seek your medical attention in a private hospital. Then secondly, our government has a big role to play. And it starts from now. The nurse that is being employed already knows that the medical director in her department has laissez-faire attitude to the work. So it goes from one level to another. So she collects tip for them to attend to you, do the preliminaries, and then all of these things. And then at the end of the day, they might, just like police coming to collect 20 now, 100 on the road, they will still go and report to their boss and then give a court to him. And so if there is a trend of corruption in the system. It seems like those crying that our leaders are not doing well, if they have the opportunity to even go there, they might do worse things. So what we are saying is, the key thing we are talking about is it right for you to, that I must deposit money if I attend to me? What if I die on the process? Please, amidst all what? Yes, I'm going to pay, but keep me alive for me to pay. Then secondly, is that if we start hammering on the theoretical things, that is not what we are saying on ground, a lot of persons are going to die in the process of pursuing their right that is not there. So first of all, you seek for practical things, workable things that will save your life, and then you could do other things. Now, how do you go to court to battle a medical director that is stuffing millions into his account on a daily basis? You will just go there and give them 2 million naira and keep this case pending for 2 years.
Yes.
So you see, but this is not the same with in the other countries where the system is working. You understand? They can't do a citizen of US something like this, even if the person has just $1,000 in his account. Once the person takes you to court, of course you are going to be in for it. So our government needs to know that, yes, even if they are not going to provide everything for Nigerians, that our health is a priority. And Nigerians has a strong spirit that they are very, very resilient. Amidst all the hardship, you will still see people making positive efforts to better their lives. So why not instill workable enforcement agencies that will be saying to these things? It's not that they are not aware that these things are there, but they have refused to actually pay attention to it. You understand? So that's just this thing. And I don't know if, because if you continue to just talk and then nothing is happening, at the end of the day, nothing might be done about it? Permit me to reference Mahatma Gandhi again, who has always employed civil disobedience by non-violence as a tool for getting the government to work. If this persists, people like us who are interested in propagating life, people like us who are pro-lifers, should actually organize non-violent show of our dissatisfaction with the medical system. We don't want this anymore. And then maybe through this way, international bodies would see the need to also intervene. Because it's not just about us folding our hand and waiting for the government. Because if we continue to fold our hand and wait for the government, at the end of the day, we might not get any result. And then you would see, now, as other countries are advancing in their life expectancy rate, Nigeria is dropping. And that's because nothing is working. So it's really a call on all of us to wake up and see what we can do to address this issue. But at the bottom line, please always put yourself in another person's place. Yes, you're a medical director, but how do you treat your own family when they're sick? I know you give them the best attention. So why not extend this? At least this is a call for sympathy and empathy. You understand? Knowing the fact that at the end of the day, who is owing you for the medical attention you've given to him? Of course, we pay. So that's my own appeal.
Okay.
Yes.
Okay. You said something concerning those. Forget about us in the rural area. What about, I think, is it urban, in the villages and the
Yeah.
people that are not civilized? In cases like this where they don't have any money to pay for the private health sector, for the private hospitals, and go there for the medical care. What can be done for them to go to the public health sector and get their treatment? If I was thinking about insurance, taking half of their money from them, but most of these people, they don't even work. So what can be done about them?
Yeah, thank you. Just like we are planning a project currently, the Rotary clubs in Imo State, we are planning a maternal and child health project next month. And that project is going to cost us over 2 million naira. You understand? We went to Inyechi maternity in Old Road, Nekede. We saw the devastating state of that maternity home. And now, this is actually one of the best that some families can afford. You see that it begs from the question, how do we get to the grassroots? A lot of people are suffering on a daily basis. Now, how can you run a maternity? There is no stretcher, no wheelchair, no baby weighing scale, no pediatric cot. In fact, people are just living at the mercy of God in the name of a maternity. And even at the end of the day, they're still going to pay.
That's terrible.
You understand?
Yes.
Now, it's possible that is the best in that locality. And now Owerri West is in the heart of Owerri. Like people can comfortably say this is the city. This is the city of Imo State. But you could see what's going on there. If you see that video, even you might even choose. I'm not sure I'm interested in giving birth because of the risk, how vulnerable it is for pregnant mothers, how vulnerable it is for TTC mothers and expectant mothers. And then talk more of the helpless baby in the womb. So if anything goes wrong there is no hope of survival. In fact, there is no space that could even let in air into the space. But I saw people coming to seek for antenatal and all of those things there. And now, how do we attend to these places? It now calls on people to make this known. Like now, we are seeking for partnership, local and international partnership, to carry out that project. Now, if we're able, what we have in plan is to make sure we provide stretcher, wheelchair, pediatric cots, baby weighing scale, and so many other things that we need to put in place so that at least you would be able to check the heart rate of a pregnant mother, to be able to monitor her blood pressure and all of these things. Because if you don't have those facilities in place, you will not even know when a woman is almost dying.
Yes.
You understand?
Yes.
And this is the reason why we are having high rate of mortality, maternal mortality. You understand? This is why it is on the rise. So what we can do to salvage this situation is to take this is evangelism. This is even more to standing on a
Yes,
pulpit and
yes,
then
yes.
tell us how we should give 1/10 of our estate. You understand? So this is what we go about doing as Rotarians, as Rotaractors. Now, when we see a place like this, we now do what we call needs assessment to really know what these people, what they have already, what they need, so that not after doing this project, at the end of the day, they will abandon it. Now we've taken a video of what the place is, and then we have now provided a proposal that we are using to write to international bodies to please step in, let's do this. And this project will be carrying it out by next month, 22nd of July, which is a month Rotary dedicates for maternal and child health care projects. So this is the way we can do it. There are international bodies and organizations who are interested in the health sector. The question is just about us finding out these people. And then take our time, mobilize some persons, visit some of these rural areas that needs these services, and then we could do a proper proposal and then send out to some of these international bodies, local and international bodies that are ready and interested to support life. This way, I think we will get a long way to combat some of these things. Because, yeah, it's just that nature even has a way of saving people. You could go to the villages and you just see a woman will just come out at her backyard. Before you know it, she has given birth. And you begin to wonder, how is God doing this thing? You know,
Yes.
sometimes it's just God that is saving these
Exactly.
vulnerable Nigerians.
Exactly.
But then,
Yes.
that is also the same way that God is saving a lot of persons. That is also the same way we are losing a lot of pregnant mothers to things that can actually be prevented. And it's a pity. And
Yes.
we really need to do something about it.
It's terrible because the internet too. There is a popular doctor. I won't like to mention his name here. He traveled to, I think that's Zaria. He traveled to that state and went to the public hospitals. Not actually a hospital. What do they call these small ones? Maternity. I think yes. When he went there, this is not a private maternity ward. He said they will use only, I think, one
That should be
hand
health
glove.
centers.
Yes,
Yeah.
they use one hand glove for to birth babies, or it can be how many mothers who are trying to use one hand glove for all of them. If you look at their trays and the things are just not very nice to look at. The roofing is just something else. And then you wonder, what is the government doing about this? We all know that the government has health insurance. I mean, health, what they call it again? They have, sir?
Is it the NHS?
No, not the NHS, but they have
Insurance
allocated funds. Thank you
Yes.
for healthcare and the rest. But then you see that corruption has taken a whole lot from this. So what do you think should be done? Like you said, true. We need tax masters to be in place for this, but it's not working. It's not working in this nation that we are in.
Can I chip in something?
Okay.
Okay. When he was saying something about the practical aspects and the theoretical aspect, if you look, I think earlier this year or sometimes last year, the National Assembly, they were proposing a bill to stop medical practitioners from traveling abroad. So this is part of the issue. Now, these people are aware of what is happening. They are aware of the decay in the health sector. Now, these are the same people that go abroad to seek medical care.
Yeah.
So they know what is happening. So when we talk about the practical, what are we going to do? Now, let's say we commend Rotary for their efforts.
Yes.
But is it enough? Now, they are talking of just one maternity in 20. This is Imo State, and we're talking of 27. This is just a private hospital, maternity, and so on. So now we have primary health care centers located in every ward and whatever they call it in the states, in the country. And every year, budget is allocated to fund this project. So I think we can't just shove the theoretical aspect, because we need to ensure that the legislatures know that there is need to make laws that will enable us implement maybe existing laws, or enable us to ensure that money that are directed for primary healthcare services are used for it. That is the one of part of the evangelism, because you cannot continue to allow some people to siphon the money. So we need to begin to raise people's consciousness. People need to ask questions. There is need for the legislative arm of government. We have them in all states, both national assembly, state assembly. So there is need for them to work on every health act, health bill. We have so many of them. We have even the people's emergency health rights and so on. So there is need for them to look inward towards those rights and ensure that they are implemented. Because without them looking at those things, I think both the public and the private hospitals will operate in isolation, like they own themselves. So that is.
Okay. So you said something concerning the legislature, right? And most people don't know that there's something called health insurance. Many people, I for one, I don't even know that something called health insurance. So, what challenges do you think people go through this to assess the health challenge? What challenges are this now? Why people cannot have this insurance? We know about it first. Like I said, I for one, I don't know there's anything called health insurance. So, what can people do to assess it?
This boils down to awareness. Now, like you said, you are not aware about the national health insurance scheme.
Yes.
So now another thing is, how do people get informed, or maybe they register? Now, if you look at the national health insurance scheme, you see that it is available to, I think, less than 7% of the Nigerian population.
That's terrible.
Because yes, and if you look at the statistics, because people that can afford it, or people who are enrolled in it, are persons that are working in the public sector.
Yeah.
So it is easy to collect money from their pay so that they can access it. Then few persons who are now working in maybe bigger private organizations that are aware, so they can say, maybe when you get employed, they will tell you so amount will be collected for health insurance, this
Pension
and that,
and
pension, and so on. So these are the people that benefit. So the common man is not even aware. The trader in Ekuko or in New Market, they don't know about these things. They don't know maybe you can put aside some certain money for health insurance, and there is no awareness. If you both the mainstream media should continue. Like in Nigeria, we have the National Orientation Agency. This agency doesn't work because it is their duty to ensure that government policies are known, but unfortunately, it's not working.
But so I think this health insurance and everything, I think that if you want to actually go for this health insurance, there is a certain amount of money you will pay to be able to make sure that okay, your health
Assess it.
is, yes, to be
Okay.
able to assess it.
Okay.
And you're paying, let me say you are a family of 4, you're paying for each person to be able to make sure you assess it.
Wow.
It's not something that you just go there and they
It's
tell you
not
that.
free,
Do you
yes.
understand? Now, the money in question, the money you're supposed to pay to assess this health insurance. Now, some people don't have it.
Oh my God.
We are talking about now the people who are less privileged to afford medical bills. Now, when you place such amount of money on health insurance for each person, each family member, now, how do you expect those people who are not able to afford medical?
They are
How
not
are they
even
supposed
employed.
to go for insurance? I don't understand, because if you're putting something in place that will favor the citizen, you should do something that will be easily accessible to anybody. Not something that there are some categories of people who will be able to access it, and there are some who won't be able to access it. Going down to the rural areas, there are lots of people. If you go there, I was opportune to visit a place when I was in life. I went to this what is it called? Oh God, I forgot the name of that area. But when you go there, people are suffering.
Oh my God.
People are suffering. Like the healthcare there is nothing to write home about. If you see the health center there, like the local health facility, it is not in the what is it called? The roof is pulling off. And rain is falling and rain is beating people inside. I don't understand. Then what are the government doing about it? You see a woman who is about to deliver, she's in there. There is no proper medical attention. Even the nurses or the midwives that attend to themselves, they are not even well equipped. So a lot of, like he said, we have a lot of increasing maternal mortality rates
Yes.
because of lack of disease. I think government should focus. We've seen the private sectors. We've seen at least, let's say an average Nigerian will be able to afford some bills. But what about the less people that cannot afford it? What are the government doing about it? They have to survive. They have the rights to healthcare. So I think government should like pay more attention to the local health facilities and make sure that they have at least the basic equipment they need to at least attend to communities.
Okay. Okay. Now we all saying something. Government. Now, if you are in the position of power,
Okay.
what policy will you put in place to get this awareness for people to know about this health challenge? Remember we said the medical bills and the rest. So what policies do you think we will put in place to help?
Okay. Thank you very much for that.
This is a general question now.
Thank you very much for that question. Now, first of all, like I said earlier, I said healthcare is every human right.
Yes.
That is something we all know, that we have the basic rights. Now, if I'm to be in the position or in power to be able to implement these laws, I think the first thing I would look at, let's leave the bigger picture, because let's start from our small communities. We could actually do a lot. I, for one, let me say, I'm not in the position, but if I were to
Okay,
be
in a smaller
and let's come to
let's
communities.
look down to the local government
Yes,
chairman.
to the local government chairman.
Mm.
I think as if I'm to be in the position, what you do is, we're talking about healthcare here. There are things you go around, you ask questions. There are things you see. Let's leave this, okay, a local government chairman, let's leave the fact that, okay, you have to tell them, oh, your community needs roads. Those are important. What
Yes.
about the healthcare? If they need facilities in the hospital, you should focus on that and tell them, okay, this thing is not working. This is what you write. So if it's a budget or something, you have to write down, write it down and send it out. So they will be aware that, okay, in this community, so and so thing is not working here. This health facilities is not working. It's not about building the roads and actually siphoning money from the government into our personal pockets. We have work to do. We have a lot of things to do out there. The communities, they need healthcare. They need healthcare services. So I think if I am to be in the position, I will actually make sure that I, for one, I go through like I go round and take a good look at our healthcare facilities, know what they need there and what they don't need, know what is going on in healthcare, create awareness, and invite the bodies, people that are interested in these things, let them know that, okay, this is what is going on here and we need assistance here. Because it's not something one person alone can do. It's a collective effort.
Yes.
So I think it's something that when you create awareness for it, you get the attention you need. So I think that is what needs to be done there.
Okay. What about you, sir?
Yeah, thank you
Because
very
you're
much.
already in a position of power.
Yeah, yes, as the leader of Rotaract in Imo State.
Okay, let's leave the Richard.
Yes, I'm not
Let's
talking about
leave the
Rotaract.
yes.
I know why I referenced that.
Okay.
The first thing is to walk the talk. It's not just about saying there is a problem in the system. You have to lead from the front. And that is why John C. Maxwell will always tell you that a leader is he who knows the way, goes the way, and shows the way.
Yes.
So I will always make out time, even if it's once every 3 months, to personally visit health facilities. That's one. Then secondly, if I happen to get the opportunity of being in the place of power, for instance, being the president of Nigeria, health practitioners who will not seek for medical attention outside the country, that is going to bring a disruptive change in the system. Because they now know that whatever affects the big affects the small. Whatever affects the head affects the tail. So they will now start reintegrating, re-evaluating the system. They will now start thinking from the inside. Because when they talk about policy, a good policy is that which emanates from the needs of the people. And now, I am a doctor, and I know if I'm feeling sick, I will go and seek medical attention in India. But then, of course, I will feel less concerned about what's happening to those seeking their theirs in Nigeria. But when I know that I'm going to seek mine here in Nigeria, it's a wake-up call. So the number one thing I'm going to do is, one, to walk the talk by visiting health facilities to make sure that things are the way they should be. Now, secondly, is to ban people seeking for medical attention outside the country. That was what Japan did when they were a developing country. They will buy a system, a laptop from USA, bring it to Japan, dismantle it, and now use it to build a new laptop. And that is how Japan is where they are today, as one of the world innovators in the industry. So that's the second thing. Then the third thing I'm going to do is to enact an enforcement agency, just the same way we have OCDA in charge of all the structures going on in where those who are members of who are enforcing that OCDA program, they are very much interested in the job because money is involved. So I'm going to institute another enforcement agency that will be in charge of visiting health facilities to make sure that all the things they need are in place. In fact, you are not going to have license if you don't have life enhancing equipment you need to work. You can't just wake up and just build a batch and then you call yourself a maternity and people will start coming there to give birth. No, I'm going to shut down everything like that. If it's not up to the standard, it's not up to the standard. If you can't afford to run a health facility place, then you can't afford it. So let's give it to people who can manage it, and then we're also going to regulate the charges. You understand? And how we're going to do that is that this is a digital age. You understand? We've gone beyond the electronic stage where you just have customers within your shops. This is a world you can sell to anybody from anywhere in the world. You understand? So we're going to have an online digital monitoring system where people would always report their experiences at medical facilities. And when there are these things in place, it will always keep owners of these medical facilities on their toes because they have a tax, one, to meet up with what the government is asking of them, and then two, they know that the government is also coming to seek the same medical health attention in, because I wouldn't put such law and then go outside to seek a medical attention myself. So even sometimes I would want to go and seek in one of the ones I feel they are in outskirts of the town to see what's going on there. So when we put these things in place, yes, of course, people are going to fight it. But then when you are a leader, there are things you must know. You must have that power of decision, because there are places you get to, your ability to make decision that has a greater rate of increasing the common good and the general interest of people becomes what you must do. No matter situation where maybe it's going to affect your friend, because your friend might be the owner of the biggest private hospital and stuff like that, and then this might not really favor him, but you have to do what you have to do in order to protect lives and properties. Thank you very much.
Thank you, sir. Sir,
All right.
yes, the 2 points.
Yes. First of all, what I would do is to ensure that the remuneration of medical practitioner is high. Because if you look at this recent Japan syndrome where nurses and doctors leave the country, is as a result of poor payment. So if you can't pay people, they won't work. So if you go to our public hospitals, they suffer lack of staff because nobody is paying them. So either they go to their private clinic, or so that is why there is so much negligence on the public sector. So if you can pay doctors, look at what our politicians earn, millions. It's not something we should talk about, but we know what they earn, different allowance, and so. What about the medical practitioner who is supposed to be saving life? So if their payments can equate what the type of work they do, I think first of all they will have that passion. When they now work, they will now work with passion, not just for the pay. Because I think when they are trained to work with passion, because saving human life is not just any profession, any other thing. You are dealing with a human being, you are saving a life. So when you pay well, people work and give you the best. So I think we will start from there. So once people are okay, they give their best.
Yeah.
And once they give their best, then other things will fall into places. Then the last one is the infrastructure. Just like he said, make sure that the public hospital gets what they need. Because the private hospitals are expensive, because most of them have it all and you can't see it in the public. So if the public hospital have everything you need in every. We have primary health cares everywhere. If they have all those equipment, I think the private hospitals are not getting because the public hospitals are usually cheaper. So if the private hospitals are not getting the same amount of patients they should get because the public hospitals are functioning, then they will come down to your level. They will cut
It's
costs.
going to create a healthier
Yes,
balance.
there will be a balance. So it is just you just do. Once you do it, you watch the system, things flow naturally. But our somebody said our country is fantastically corrupt, so we just keep praying for the better.
All right,
Thank you.
yes, it has been a very educative time in the show today, and now we know our rights, which is very important. And I've learned something too, knowing about the insurance scheme that we have in place. So do well to like us on Facebook and on Instagram at Serenity TV, and also follow us on Facebook too at serenitytv.com. Thank you very much.